This is the hip flexion assessment. We're going to stand with our feet roughly hip width apart. We're going to pull the kneecaps up, contract the quads, and lock the knees. So the legs must stay straight in this assessment. We place our hands behind our head, and from this position we need to maintain a flat back as we hinge at the hips. So we're sitting the hips back and we're leaning the torso forward, maintaining that flat back and finding out how far down or how much you can flex at the hips, holding this for 15 to 20 seconds before standing back up. So the primary goal here is to think about closing the hip angle or flexing at the hips while maintaining a flat back. A common mistake here is to bend the knees, or it is to allow the back to start rounding, or both. So we've got to focus on keeping those knees locked and hinging at the hips, allowing the pelvis to tilt while maintaining that flat back and going as low as you can in this hip flexion assessment. It's best to video this from a side view so we can see that the back is staying flat, the knees are staying locked, and the angle that you're getting between the legs and the torso as you flex at the hips. This is the hip flexion assessment.